Hi, I'm Jill Stokel with The Advocate. I'm here today at the Baton Rouge Clinic, and I'm joined by Dr. Kelsey Pasch. She is one of the rheumatologists here, so thank you so much for being with us today.
Thank you for having me.
Okay, so I know in the field of rheumatology, there are a ton of different types of arthritis specifically. So do you mind sharing with us, what are some of the most common types of arthritis?
Yeah, so far and away, the most common type of arthritis is something called osteoarthritis. So we call that wear and tear arthritis, which is the most common far and away. But that is when, so the joint is made out of two bones that's lined by cartilage. And so what osteoarthritis is over time, due to mechanical stress or being on your feet a lot or using the joint a lot, the cartilage gets broken down. And you end up eventually at the end stages of it having bone on bone.
Right.
And so that type of arthritis really gets worse with use of the joint and just being on the joint more.
Right.
And with being obese or heavy, just any more stress, mechanical stress on the joint makes it worse.
Impacts it. So what are some other types of arthritis that you might encounter?
Yeah, so another type of arthritis that I specifically see is rheumatoid arthritis. So that arthritis causes the same pain in the joint, but it's a little bit different. That's mediated by the immune system. So the immune system, for whatever reason, genetics or an environmental trigger, causes your immune system to attack your joints. And it looks a little bit different than osteoarthritis. You can have swelling of the joint, and it usually actually gets better when you use the joint. So it's opposite from osteoarthritis.
So I've, in some relatives, I've noticed very swollen knuckles. Would that be rheumatoid arthritis?
Yes, sometimes.
Right.
So osteoarthritis can go in both, we call these the PIP or proximal interphalangeal joints and the DIP, distal interphalangeal joints. Osteoarthritis can go in both, whereas rheumatoid arthritis only involves the PIP joints. There will be more swelling, a lot of stiffness, prolonged morning stiffness, like for over an hour in rheumatoid. Whereas, there's not as much stiffness for prolonged times with osteoarthritis.
So aside from swelling and stiffness, are there other symptoms that a patient can be on the lookout for that they might need to, seek out a rheumatologist to assist them? Yeah.
So rheumatoid arthritis can affect other organs as well. It's rare, but it can affect the eyes, the lungs, and the lymph nodes, and just cause constitutional symptoms, we say, like fevers, chills. If it's really bad, just from uncontrolled inflammation in the body, you can have weight loss. But predominantly the symptoms are the joints, and particularly in the small joints, like of the hands, the feet, and it can involve the knees and the shoulders, but it usually spares the back and the spine.
Okay. So are there any things, I know you'd mentioned like movement and also weight. Are there any things that people can do to kind of, help themselves not get arthritis?
So we do know that smoking is a huge risk factor for developing rheumatoid arthritis, and it can increase the risk tremendously. And in terms of preventing osteoarthritis, regular exercise, maintaining a healthy weight, an anti-inflammatory diet like the Mediterranean diet is what we recommend.
Okay. That's great information. Okay, so you mentioned, because that's always been one of my questions, are there types of arthritis that are hereditary?
Yes, there's lots of arthritis that's hereditary. Particularly rheumatoid, a lot of our autoimmune diseases are inherited or hereditary, and those can also cause a similar arthritis to rheumatoid, but mediated by the immune system.
Okay.
And gout can cause an arthritis, and that does have a component of being hereditary.
Okay. With all of the new treatments and what are some of the new treatments and for arthritis that you are using with your patients?
Yeah, so again, depends on what type of arthritis. Unfortunately, osteoarthritis doesn't have great treatment. The main treatments that I tell my patients are the exercise, the weight loss. Physical therapy is great. Really, the only cure for osteoarthritis is going to be knee replacement or joint replacement with orthopedists. But to prevent that, before we get to that step, we can use topical anti-inflammatories, physical therapy, weight loss. I tell my patients about turmeric, which is a good, just natural supplement. It's anti-inflammatory. And then we can also give joint injections
Okay.
And that can all be done before getting to the point of needing a knee replacement or joint replacement in general. But in terms of rheumatoid, there's specialized drugs, specialty drugs that we use to target the immune system to cut down on inflammation.
Have you seen changes over the years and improvements, if you will, in the treatments for arthritis?
Oh, yes. Yeah. Back in the day, when you had rheumatoid arthritis, you'd see people with a lot of deformities and a lot of joint damage from progressive rheumatoid arthritis because we didn't have great treatments back in the day. But now we have so many medications and different mechanisms to target the immune system in different ways because not everyone responds in the same way to each medicine. So we really take a tailored approach or treatment, and they are really helpful.
Okay.
Mm-hmm.
So what inspired you to become a rheumatologist?
Yeah, so I mean, on that point, I really like the medicines we use. It's I enjoy getting to talk to the patients, getting to know them personally, and finding a medicine that fits for them.
Mm-hmm.
And I'm just thankful that we have a lot of medicines for rheumatoid that target the immune system now, that we can kind of come up with a tailored approach, and that really helps patients get back to a normal quality of life.
Right.
Mm-hmm.
Is there anything I haven't asked you that you want our viewers to know about seeking treatment for arthritis, or, giving them hope or something that can inspire someone who is walking through that?
Yeah, I mean, I think that any type of arthritis, here at Baton Rouge Clinic, we're happy to see you. But just have hope that we have great treatments for rheumatoid and other types of arthritis, and we'll be able to help you out.
Right. And so they can go on living in a great and happy, healthy life.
Yes.
So, Dr. Pasch, thank you so much again for your time today and for sharing your knowledge with us.
Mm-hmm.
Guys, for all of your healthcare needs, don't forget, come to the Baton Rouge Clinic and support local.